Coming up next at 5:30, a big push in the fight against ALS is underway in Connecticut. We'll fill you in on a new clinical trial when we come back.
In Health News tonight, we begin with a story focused on ALS, commonly known as Lou Gehrig's disease.
There is now an ALS certified center in this state, and News 8 medical reporter Jocelyn Memento was at the hospital for special care to learn more about the groundbreaking clinical trials underway.
Chris Venslovas appears to be full of life, but spend time with her, and life isn't what it seems. Daughter Christina and a high-tech board help to tell her story.
She can't talk at all. No speech whatsoever.
Chris has ALS.
Very difficult to swallow or eat.
This retired nurse was diagnosed with a disease that targets the body's voluntary muscles a year ago here at the Hospital for Special Care in New Britain.
When you think of ALS, what do you think about, Chris?
Death.
Research by the likes of neurologist Dr. Jinsey Andrews offers hope.
No one knows when or if they're going to get this disease, so it just comes out of the blue, and we don't really know what causes it, so it's a scary disease.
A phase 3 clinical trial of an FDA-approved antibiotic is well underway here.
We're trying to slow down disease progression by giving continuous infusion of ceftriaxone.
Chris was the first to sign up for the double-blind study.
Do you think it slowed down some of your symptoms? The progression of your symptoms?
You don't know. Like to think so.
With no blood or imaging testing for a clear diagnosis, patients like Chris are often misdiagnosed.
They are diagnosed clinically based on their physical exam and based on their history and based on the fact that there's nothing else to explain why they have that disease.
The slurred speech is typical of an ALS patient, and that was one of the first indicators that she noticed.
Raising more awareness of the disease that claimed the life of famed Yankee slugger Lou Gehrig is putting a smile on Chris's face.
So we'll continue with the infusions of the medication.
Taking part in the research empowers Chris.
Don't give up. We need fundraising for research. If we have research, we have hope.
Dr. Andrews has another ALS phase 3 trial about to begin. This one is international, and it focuses on an experimental compound also aimed at slowing down the progression of ALS. For more information, log on to WTNH.com. Back to you.